Hey, welcome into Strictly Speaking, the trans nation. I think that's a pretty good thing to call it, actually. The trans nation that we have become over the course of the last decade or maybe decade and a half is really something that continues to divide Americans. The President of the United States has made a directive that we will no longer recognize multiple genders. There are men and there are women and there are males and there are females, and that is it. Others are still pushing back. Today, we're going to talk with an expert in the field, Dr. MIRIAM GROSSMAN is board certified in child, adolescent, and adult psychiatry. Before gender ideology was on anyone's radar, she warned parents about it in her 2009 book about sexuality education. You're teaching my child what? Dr. Grossman's practice focuses on gender distressed young people, which is a great way to put that, I suppose, and their parents. She believes that every child is born in the right body. She's been very vocal about the capture of her profession by ideologues, leading to dangerous and experimental treatments on children and betrayal of parents. Dr. Grossman is a senior fellow at DoNoHarmMedicine.org, and she is the author of 5 books, the latest of which is Lost in Trans Nation. That's where I stole it. A child psychiatrist's guide out of the madness. Today, we will discuss the latest on the path out of the trans wilderness for kids, for parents, for educators, and yes, for medical professionals, right here on Strictly Speaking. Dr. Grossman, thanks for the time. I appreciate you being with us today.
Well, thank you, Bob, for having me.
Well, we have spoken on the radio a couple of times, in fact, and I know you talked to a lot of people to get this message out there, not only about your book, but more importantly, about what inspired your book. Dr. Grossman, let's start there. What inspired Lost in Trans Nation?
Well, Bob, what inspired it was the many, many hours that I spent with hundreds of families who were and are dealing with the very difficult situation of having a child who is confused about who they are. That is what I devoted my practice for the past 5 years. And I heard so much and I saw so much that I felt compelled to sit down and write another book. I've written other books, but this book would be exclusively about the transgender phenomenon and how parents need to understand what it's all about, how it came to be, and how they can protect their families from it. That was the motivation for the book.
You called it a transgender phenomenon, and you talk about the origin of it. Explain that. What is this, and how did we get here to the point where you have statistical impossibilities given the generally accepted statistical less than 1/4 of 1% of people have the unique psychological condition of gender dysphoria. Suddenly you have a classroom filled with 28 students and 17 of them are transgender, and parents who have, I have one non-binary child and I have one transgender child and I have one non-gendered child, or whatever. These things are simply not possible. So it is a phenomenon. How did we get here?
Well, we could be here all day talking about how we got here. We got here basically because of fraudulent research, because of professional organizations that gave in to activism, because of doctors, therapists, educators, lawmakers who were who didn't have the courage to stand up for what they knew was true, because of pressure, political pressure and other kinds of pressure. So, there's a very long answer to how we got here, but that is the short answer. The research behind all of this, the idea that everyone has a gender that could very well be incongruent or at odds with their body, that everyone has a gender identity, and that when a person's inner feelings or identity is at odds with their physical reality of their bodies. It's the feelings that override the material reality. That is the idea that is at the very core of all of this. That you are who you think you are, and it doesn't matter if you might be 3 years old or 80 years old. It doesn't matter if you have schizophrenia and psychosis or depression or autism. If a person proclaims that they have a new identity, then all the adults in their lives, their therapists, their parents, their teachers, their psychiatrists, their pediatrician, is supposed to rubber stamp that identity. That is what is behind this. But
Okay.
yeah,
Well, you got us kind of to where we are, and a lot of the different elements of how we got to where we are. But I want to go back even further to the extent that you can about when did this become a phenomenon? When did this start? And in other words, and also where and why? I mean, we know the social contagion. A lot of people like to call it a woke mind virus. That there are a lot of influencers that are getting to kids at a very young age. Some of them in their lives and in their schools. Some of them online on their screens. I get that, and how we have just become taken in by all of this. But for example, you wrote that first book about all of this in 2009. You're teaching my child what happened in 2009 or 2005 or whatever led up to the
okay.
writing of that book that really got us started in this. Where did somebody just flip a switch and say we're going to do this now?
No, it wasn't flipping a switch. And by the way, the book that I wrote in 2009, You're Teaching My Child What, was essentially about sexuality education and the dangers of sexuality education, which is also a very important topic. But I had one chapter in there about gender because I discovered while researching sex education that kids were being told about gender ideology, and that when they're born, the adult in the room made a guess about whether they're a boy or a girl, and that guess may have been right or it may have been wrong. So, that idea was very alarming to me as a child psychiatrist, and I wrote about it. But I think what you're trying to get at is John Money, all the way back in the 50s and 60s and 70s. So I can tell that story. It'll take a little while, but it is a
I
story.
think it's worth it because I'm familiar, but a lot of people are not with John Money. But this didn't take root in the 50s, 60s, and 70s. It didn't take root until the 2000s in the scale that it is now. So that's what's fascinating here. Please.
Okay. Well, John Money was a psychologist, originally from Australia. He grew up on a farm in Australia, and I'll tell you in a moment why that's important. And his area of interest was, we no longer use this term, but hermaphrodites. We now call a hermaphrodite, which would be a person who is born with elements of both male and female reproductive system. A very, very rare situation. These people are now called having, well, they were called intersex, and then the name was changed again to disorders of sexual development. So John Money had a special interest in babies who, at the time of birth, now this is before ultrasounds and before the tests that we have now to determine male or female before birth, and you would find out the sex of a baby in the delivery room. And in those very rare instances, about 1 in 5,000 births, in which the genitalia were not clearly male or female, it was an emergency, because what are you supposed to do? What do you tell the family? What does the family announce to the world? what kind of name do you give the child? You know, it would take time to determine, run the tests and determine what were the chromosomes and what are we dealing with here, a boy or a girl. And then how do you raise that child as well? If they have atypical genitalia, are they boys or are they girls? So John Money came up with a theory. And his theory was that all of us are born gender neutral. In other words, we have the potential of really living as either sex. And it's all based on our identities as male or female. There were only two options back then. Our identities are based on the messages that we get from society. In other words, being male or female is a social construct. It has to do with how your parents treat you, what their expectations are, what kind of toys they give you, what outfits they put you in, and so on and so forth. And so John Money hypothesized that any child could be raised as the opposite sex as long as it was started early enough in their lives. And he was the first person to use the term gender to apply to people. Because before that time, gender was a grammatical term. You know, in certain languages, in Spanish and French and many other languages, words are either masculine or feminine. Nouns are either masculine or feminine. We don't have that in English, but as many of your listeners are aware, we have that in other languages. So the word gender had always been a grammatical term. But John Money took that term and he applied it to people. And he said that all of us have a gender, which is an inner feeling or inner experience of being male or female. And he proposed that we're born gender neutral, but our gender is solidified, permanently solidified by the age of 3, depending on our environment, depending on what society is telling us. So John Money said, if these kids that are born with ambiguous genitalia are actually gender neutral, then they could be raised as either male or female. And gender, you should understand, Bob, that gender is separate from sex. A lot of people, especially these days, are using the terms gender and sex as if they were synonyms. They are not. Gender is defined as an inner feeling or experience of being either male or female. And sex is a biological term. Sex is related to whether a person's reproductive system is organized around producing eggs or sperm. Only two choices because there's only 2 reproductive cells. So John Money came along and said, we have sex, but we also have gender. And gender is actually more important than sex. So the way that we are raised up until the age of 3, he said, the messages that the child gets is going to override the biology of the child. And whether they have whatever chromosomes they have, whatever their genitalia are, whatever their hormonal status is, whether they produce estrogen or testosterone, and so on and so forth. Now, I want to just emphasize that when we think about John Money and what was going on historically, this was before we knew as much as we have learned now. We've learned so much about the intrauterine environment of the fetus and the hormonal environment and all the things that go on pre-birth. Very, very important changes and developmental issues that go on. We know now that the fetus begins to be masculinized at the age of 8 weeks. 8 weeks after conception. That's when the testes, the tiny testes in a male embryo begin to secrete testosterone. And the testosterone goes all over the body, including the brain, and it masculinizes the brain. Now, I'm speaking now in rather broad terms. This is a complicated subject, but overall, this is the case. Now, John Money didn't know any of that, and we were nowhere where we are now in terms of understanding these things. So John Money had this theory, and he happened to have been a very impressive guy. He was a professor. He was at Johns Hopkins University, and people were really taken by him. When John Money spoke, people listened. And so John Money was talking about this, but he couldn't prove his gender theory. He couldn't prove it until a certain family showed up in his office. This family was the Reimer family from Vancouver, Canada. And they were a family that had gone through a terrible tragedy. What had happened is they gave birth to twin boys. The boys were healthy and fine. They took them in at the age of 8 months for circumcisions. And during the circumcision of the first boy, whose name was Bruce, something happened to the equipment and his penis was burnt off. So the Reimers were left with this child who, he still had testicles, but he didn't have a penis. And then his identical twin brother, who did not go through with the circumcision. After that happened, you might imagine that they decided not to do it. And they were left with these twins, and they were at a total loss as to what to do and how to raise Bruce. So, and they were, I should mention also, a blue-collar family. I don't even know if they had, they had a high school education. A young couple, maybe 20 or 21. And one day, they heard John Money being interviewed on television. And John Money said that a boy could be raised as a girl successfully. It just had to be done early enough in his life. And the Reimers heard that, and they thought that this is the answer to their prayers. They made an appointment with John Money, and they traveled down to Baltimore with their twin boys, who at that time were about 1.5 years old. Now, later on, Bruce's mother said that she looked up to John Money as if he was God. And it's not hard to understand that, because he did come across as as a not only an expert, but as the top world's researcher on this issue. And he spoke in a very authoritative way. He was the head of a clinic in Johns Hopkins that was focused on individuals, adults, and, well, I should mention that there's a whole group, as you know, of adults, mostly middle-aged men, who decide at some point in their lives, usually after they have a family and children, that they wish to live their lives as men. That is a totally different situation than the kids that we have now as teenagers, who are suddenly identifying as the opposite sex. But John Money's clinic in Baltimore was focused on surgeries and treatment of those mostly middle-aged men, some of them women as well, and these newborn babies who were in a situation that their families needed help and guidance. So the Reimers went down there and they just did exactly what Dr. Money told them to do. And what he said was that they need to castrate Bruce, remove his testicles, um, give him a surgery that would create female looking genitalia, change his name, um, and raise him as a girl and never ever tell him that he was a boy. So the Reimers did that. They Bruce had his surgery. They changed his name to Brenda. They put him in pink frilly dresses. They gave him dolls, and keep in mind that this was the 60s, the 70s. There were still very clear, roles and toys that role models and toys that parents would give to their kids. They would, the dolls versus the trucks and the GI Joes and the Barbies. So his brother, in the meantime, his identical twin brother, would get the GI Joes and the footballs, and Brenda would get the dolls and the other girl stuff. Now, the reason why this was a dream come true for Dr. Money is that it was the perfect study for him to conduct that could possibly, if it had a positive outcome, prove his gender theory. Because you see, Bruce and his brother Brian were identical twins. They had the same chromosomes and they were being raised in the same environment. So both the biology, the chromosomal part of it, and the family part of it, the environment, was identical. And so it gave John Money the possibility of being able to say, look, here's two identical twin boys, and one of them has successfully been raised as a girl. So what happened is that Brenda was raised as a girl, and every year the family would travel down to Baltimore, and Dr. Money would see the twins separate from their parents, talk to them, question them, and after a few years, when the twins, I think, were 6 years old, he publicly announced, both in the professional literature and in the lay literature to the public, that this experiment was 100% successful. He didn't use the twins' actual names, obviously. He gave them different names, but he said that Brenda, I think he called Brenda Joan, was successfully thriving as a little girl, that she was doing well in school, that she was fit in socially with the other girls, that she might have some traits, some tomboy traits, but overall, the whole family was doing great. And obviously, he began to get a lot of attention. But what happened was eventually that when Brenda hit adolescence, she became very well. The truth is, she had never been doing well. She never felt good as a girl. She would tear off her dresses. She wanted to wear her brother's clothes. She wanted to play with her brother's toys. She was rejected by the girls. She was called cave woman because she was so incredibly masculine. So this was not at all a success, much to the contrary. She became suicidal when Dr. Money began talking to her about having surgery to create a fake vagina. and she refused to ever go down and see him again. Um, um, she was told the truth by her parents. Both she and her brother were told the truth. And Brenda went immediately back to living as a boy. She experienced tremendous relief, and she picked the name David. Um, David, uh, unfortunately, and his twin, so
Mhm.
they had both been really very profoundly damaged by this whole experience. It came out that every year when they went down and visited Dr. Money was sexually abusing them. Um,
Oh,
he was he was quite a bad guy, quite an evil man. Um, he did terrible things to that family, and he never announced publicly in the literature. He never uh, acknowledged that he had been wrong, and that his proof of concept experiment on these twins had proved the opposite, that obviously this was a boy. And even though he was social, what we would call now, it's the perfect social transition, he himself didn't even know that he was a girl. So it really was a disaster, and the two boys ended up, both of them, committing suicide.
that's
So
the part that I knew. Yeah, and I wanted to get that out for people to know that the boys, and we will call them boys because that's what they are, and that's called kind of the point that we want to get to here. It didn't go well, and so I don't know exactly what age they were when they did commit suicide, but I just kind of want to again do the time thing here and
yeah,
say if that was ultimately recorded, even though John Money didn't report it as so, if it was ultimately recorded as a failure, a failed experimentation that was almost Goebbels-esque, in my opinion, or not Goebbels-esque, but uh,
Mengele.
Mengele, thank you.
Yeah.
In what they did to the experimentation on children during the Holocaust, if it went down that way, again, why would anybody else ever want to then pursue, hey, let's see if we can change the sex of our kids by way of surgery and behavioral or
Okay,
environmental issues?
it's a great question, and I also want to throw in there that this demonstrates the damage that's done when professionals with a lot of diplomas on their wall um, mislead families, and they use their professional standing, and they use the fact that the family is desperate to 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 impose on them their particular views and their particular beliefs about how things should be, which was what John Money was doing. He wanted his gender theory to be proven correct. And for decades, before David stood up and told his story, which was only in his 30s, in the late 90s, I think it was 1998, when he found out that John Money was reporting his case to be a success and that other boys were being castrated based on John Money's claim that he did well as a girl.
Mm-hmm.
That's when David stood up and said, "No, I'm not going to let this happen to other boys. I'm going to start talking about it." And he did. So the thing is, though, that there was a huge gap of a few decades in which this idea that we are born gender neutral, that this idea that that we all have a gender that can be separate from our material reality, and that it's more important than our material reality of being male or female, it penetrated academia, and it penetrated uh, the soft sciences, psychology, social work, counseling, but even some of the hard sciences, even some of the fields of medicine like endocrinology. So, because it was of this huge cover up, and because John Money um, hid the truth, this began to penetrate into various domains in our culture. And it was especially picked up by radical LGBT organizations and leaders in those groups who very, very much wanted to push this idea that biology doesn't matter, that everything is a social construct, everything is what you believe it to be. And sadly, this happened in my profession as well, in the mental health profession. Now, how is it that this condition of what used to be called gender identity disorder or gender dysphoria, which neither of which David had, David was a unique case of a kid who just went through this terrible circumcision accident. But this was supposed to be the proof of concept of the idea of gender and gender identity overriding biology. And so for decades, people were led to believe that that is true, that biology is only secondary. And that's what kind of led us to the point of so many people going along with this idea. But it was still incredibly rare until about 10 to 15 years ago. It was
Right.
still very rare to have any individual, an adult, a child, a teenager, meet the diagnostic criteria of what's now called gender dysphoria. Now, there are many reasons why we have had this sudden skyrocketing of cases. And when I say skyrocketing, the number of cases has increased by about 4,000 to 5,000%.
That is extraordinary. And that is, of course, impossible. Impossible for the number of cases to actually be gender dysphoria or gender identity disorder.
No, they do actually have gender dysphoria, Bob. I'll explain. You see, prior to this explosion of cases, the only individuals that got diagnosed with gender dysphoria were the very young kids, such as, do you know who Jazz Jennings is?
I know the name, yes.
Okay, so Jazz is the poster child of childhood onset gender dysphoria. These are kids who at the preschool, they're 2, they're 3,
Yeah.
they're 5 years old, and they insist every day in an ongoing, persistent manner. They are not, they are not their bodies, they are the opposite sex. It causes them distress, it causes the family distress. It's extremely rare, but it does exist. It's a psychological disorder. We don't know why. They're completely normal physically, but they do have this persistent condition. Most of those kids, a majority of them, if you just allow them to grow up and go through normal puberty, by the time they reach early adulthood, they will have gone through it. They will have reached a sense of comfort with their bodies. They no longer wish to be the opposite sex. Many of them are gay and lesbian, but they are at peace with their bodies. So that is childhood onset gender dysphoria. That really does exist. Now,
To what extent, though, Dr. Gross? Because I'm a little confused. As we talked before, a very, very tiny percentage of the population period is identified or diagnosed with gender dysphoria. And then you said increased 4,000 to 5,000%. But what did that increase it to in terms of the overall population? And was that driven by societal or, again, social contagion where kids are
yes.
encouraged in their confusion? And the reason why I said it's impossible is because I'm thinking of it solely as the psychological or psychiatric condition, insofar as the number of people who have multiple personality disorder. That number doesn't go up exponentially because of social contagion, but yet gender dysphoria
Yes.
diagnoses went up exponentially. I want to talk about what caused that, and
Okay.
it's not just brain disorders.
Okay. It is a complex subject, so I'm trying to
Yeah.
fit a lot into a small amount of time. People who really do want to get into the nitty gritty and understand all of this really should read or listen to my book. Now,
Amen.
there are a bunch of factors that have contributed to the skyrocketing of cases. One is social media. We know beyond any doubt, and I see it in my office all the time, kids who first hear about the possibility of being the wrong sex, of their bodies being wrong, they hear about it on YouTube, on Instagram, from friends, on social media, or at school. Of course, we know that our schools are, unfortunately, some of them filled with activists, teachers, counselors who are teaching these kids that they could possibly be transgender. If you don't like your body, if you feel awkward, if you have trouble making friends, if any of a long, long list of symptoms, you have anxiety, you have depression, hey, you may be transgender. So these kids do develop real gender dysphoria. They do. They do develop an intense dislike for their breasts or their, facial hair or their voice that's getting lower because they're hitting puberty, the boys. They do develop those symptoms and they do actually qualify for the diagnosis of gender dysphoria. The thing is that it has happened through this process of hearing about it from friends. And there are
Hmm.
many other reasons as well. For example, the American Psychiatric Association in 2013 normalized this condition of rejecting your body and being uh, dissociated from your body. They normalized it by changing the name of that condition from gender identity disorder to gender dysphoria. So psychiatry no longer considers it a disorder when a person is so intensely uncomfortable with their biology that they actually want to have their breasts, their normal breasts, surgically removed, their normal penis surgically removed. This happened within psychiatry. It was a decision that was driven by three factors: politics, compassion, because psychiatrists and psychologists who were making this decision in this small committee of people were concerned about stigma. They were concerned that people who had this diagnosis were being stigmatized by it. And lastly, they were concerned about, um, uh, so it was politics, compassion, and access to care. A lot of the activists at that time wanted to remove the diagnosis completely from from the DSM, the manual of diagnoses, psychiatric diagnoses. They just said remove it. So why not remove it? What the argument was, if we remove it, we no longer have a code to use on insurance forms for reimbursement for treatment.
That's pretty alarming. The idea that they would consider it, the factor that they would use, that they would consider most here is access to treatment and, like you said, payment for this. And also, when you said they did not like the language of gender disorder, gender identity disorder, changed it to dysphoria, how long did it take for the psychiatric associations, which is, I'm assuming, who was behind the shift from dysphoria to just gender identity? Identify as what you wish. Everybody can. And then it goes from long ago removed from John Money and male to female, but male to female and back to male again, because we can do it by the season. And not only male to
Right.
female, but I am neither one. I am just, some days I'm so masculine and some days I'm so feminine. I'm neither. I am non-binary. And then, of course, we get into the ultimate insanity, and I'm sorry that's not an appropriate clinical term for a psychiatrist like you, but the insanity of cross speciesism. The idea that I am not even human. I identify as some sort of an animal spirit or an
So,
animal in some way. All of this stuff now is getting into some very, very dark stuff.
okay, so I agree with you that it is out of control. It's been out of control for a long time, and people finally are waking up to how bad it is. We've actually been putting these ideas in front of kids for a long time, and I've sort of been sitting here watching it play out in slow motion. I want to emphasize as a psychiatrist that this madness, this insanity, um, it was never um, it was never approved by any sort of referendum of psychiatrists. These are activists within the organization. The same thing is true of pediatrics. People have to understand, parents that are listening to this show have to understand that the American Academy of Pediatricians has been totally captured by gender uh, maniacs. And when you go to your
So is the APA, right? The AAP and the APA, they both have.
yes, yes. Um, I have hope that things might turn around. It's just going to take time because the activists were extremely successful at you know getting their agendas in, having policy statements and guidelines be published based on just sometimes it was only one doctor that wrote the guidelines for an entire organization. So, there's a lot of fixing that has to happen here, but parents must be aware that, be very careful about who you take your child to see. And I don't only mean a pediatrician, obviously, I mean a therapist as well.
Oh yeah, I want to speak to that to the APA, the American Psychiatric or Psychiatrist Association, I guess it is. You and your colleagues at Do No Harm and a ton of other clinicians and experts and so forth wrote a letter. It was 23, I want to say, in 2023, to the American
Correct.
Psychiatrist Association, asking them to remove or revoke a book that was put out on this, in which they push and promote gender affirming care, if you will, almost entirely, never once considering the idea that maybe we need to push biological reality and allow this confusing phase to to work itself out. Tell me about that letter and tell me about what reaction or response from the APA you
Yeah.
received.
Well, in 2023, a book came out. It was published by the American Psychiatric Association, and they called it an essential textbook. And the name of the book is Gender Affirming Psychiatric Care, I believe.
Mhm.
And it is nothing less than a manifesto. It is just, it's all, it's the most unbelievable, male and female is a myth. Cisgender psychiatrists have harmed, the transgender community. Um, every person, regardless of age, and even, you know, whatever psychiatric diagnosis they might have a right to medications and surgeries. Now, mind you, your audience, I'm sure, realizes that um, medical interventions and surgeries are, um, extremely invasive, can cause infertility, permanent sterility,
Mhm.
raise the risks of many, many serious medical complications, cardiovascular problems, cancers, liver disease. I mean, the list is very, very long. So here we have the APA actually publishing a book. And this book, they're proud to say in the introduction that a majority of the authors of the different chapters are from the LGBT community and have the lived experience, which is the phrase that they like to say, lived experience as transgender individuals. So it is a manifesto. So a few of us uh, wrote a letter to the American Psychiatric Association demanding that they account for this textbook. Um, and I don't know if we asked them to remove it, but certainly to be accountable for what's in there. We wrote to them in December of 23, and we have yet to get any sort of response. So this just shows you, um, the power of a small group of activists and how successful they have been. Again, I am sure, Bob, I mean, I have not done a referendum of my colleagues, but I am sure that if you were to anonymously uh, survey all the psychiatrists in this country, that a vast majority would be troubled, to say the least, at what this book is, textbook. And this is a textbook, you see, that can be used in medical schools, okay, in programs where doctors, social workers, and psychologists are being trained.
And they have not responded. And I took the time to print out the letter actually in preparing for our conversation today. And end of the first paragraph, we have grave concerns about the American Psychiatric Association's GAPC textbook. Until those concerns are addressed and the textbook's errors corrected, we call on the APA for its withdrawal.
Oh, good. Okay. I
They
couldn't
haven't withdrawn
remember.
it.
Yeah,
Yeah, they haven't withdrawn it. And according to what you just said, they haven't even responded to it. Now, this is
correct.
supposed to be, I mean, this is supposed to be like the body, right? I mean, the ultimate authority on psychiatric care,
But
the
yeah.
association.
Listen, Bob, listen. I have been to Capitol Hill a few times, and I'm going to be
Yeah.
there again soon. And I am calling for congressional hearings so that people and organizations are held accountable for what they're doing. That's
Good.
it.
It's long overdue. And I talk to members of Congress on a fairly regular basis on the radio every day. So, these are conversations that I've had as well. And I hear a lot of genuine concern and I hear a lot of promises. We're going to look into that, but I never see a lot of follow up. That's from Congress, and obviously you're not getting that from the APA either. We've only got about a little less than 15 minutes left, Dr. Grossman. I want to spend that on the subtitle of your book. I want to end this conversation for today, and I hope to have more in the future, with something positive here. The subtitle of Lost in Translation is A Child Psychiatrist's Guide Out of This Madness. So let's talk about some advice. Let's talk about what you want parents to know if they find themselves in this unenviable position of the kids coming home and saying, I think I'm a girl, I think I'm a boy, I think I'm the other sex. And I
Okay,
say it
well,
that way on purpose because there's
I
only
would
the two.
I would start even before that. I
Okay?
tell parents, I tell parents that from the time their kids are very young, they should explain that there are boys and girls and that boys and girls are both, it's fantastic. Say, for example, you have a little boy. It's wonderful that you are a boy and you've always been a boy from the moment that you were created. You were a boy and you will always be a boy. And that's fantastic. But you know what? There are also different ways of being a boy. Of course, you want to wait until the child is, you have to know your own child and when they're ready to hear this. But there are many different ways of being a boy. And not all boys are into sports and into cars and,
Mhm.
typical boy stuff. There are boys that like other things. And not every girl is into makeup and fashion. So you want the child to understand that they have always been a boy or a girl and they will always be that, that it's wonderful, and that they don't have to feel they have to fit into a box, because that's what part of this gender ideology does. It says to kids, if you don't fit into the stereotypically boy or masculine box, maybe you're a girl, and you want to arm your kids with that knowledge. You want to arm your kids, for example, with the knowledge that you're not assigned a sex at birth, not at all. Your sex was established at that very first second that you existed. Because when they hear that phrase, they go out into the world and they're going to hear the phrase sex assigned at birth. I want kids to already know, red flag. That's not true. Sex is
Yeah,
not
because
a
that makes them think I want to go be reassigned. I don't like the way I was
correct.
assigned. I want to be reassigned. Yeah,
Correct.
that
The
that's
doctor made a mistake. I want to be reassigned.
To
So
the
that's
part you said a moment ago, Dr. Grossman, you said every child is different and every parent needs to know their child as far as at what age they can begin to have these conversations so that they understand it. Here's what I fear, and you can speak to this as an expert in child psychiatry. I'm worried about you have to have that, in my opinion, even before they're ready for it, if they're going to be in preschool. Because the internet is filled, particularly TikTok and Instagram, with videos of preschool teachers in rainbow colored classrooms and blue hair and talking about how their little 3 and 4 year olds, before they even get to kindergarten, are trans. And if kids are in that environment listening to the preschool teachers praise Mikey, who's Michelle, and he's so special. Everybody wants to feel special. Me too. I want to be special too.
that's
So
correct.
even if your kid isn't ready for that, don't parents kind of have to be ready? Almost, you have to be preemptive, I think.
Well, you have to be preemptive in the sense that you need to go in there and see that preschool room and see what's up on the wall and see what the teacher looks like and what her beliefs are. Because if you expose kids to ideas that they're not ready to hear, they might just not absorb it. That's the thing. But yes, you have to, of course, be preemptive, and you have to. I have an entire appendix in my book instructing parents on getting control of their child's internet use. You have to also be aware that our schools, middle schools, high schools, are also filled with these activists that you've described very well who are on TikTok. You do not want your child being seen by any school psychologist or school social worker unless you have been informed and you know who that person is and what it's all about. I have had many kids come to me who first got the idea that they may be transgender at school from their school counselors.
What about parents who don't find out until after the fact that Patrick is Patty when he's at school, and then they would change his clothes back to boy clothes when he goes home, and shh, don't tell mom and dad. Mom and dad don't understand the way we understand, because that is happening and that freaks me out.
Yes. Well, look, that's another, Bob. We could be here a few hours on that. Basically, you know, you have to understand if you're sending, even if your kid's in Catholic school, I don't care where they're at school. There
You're right.
are, yeah, it's in practically all the schools. You have to vet the school, and you have to. There are letters. There's one on my website that you can present to the principal, regardless of where your kid is at with any gender issue. And that letter will say, I do not give my permission for my child to be exposed to these ideas in class, after school, in any special groups, any visitors, visiting speakers, the assemblies that you may have with speakers. I do not give my permission. I don't give my permission for any sort of social transition using any different name or pronouns for my child. This is a big problem because there is legislation, for example, in California, that the schools are obligated to keep it a secret from the parents unless they have the kids okay.
Yeah, and there's another element to this. When you say you as parents should vet the schools, vet the preschool classrooms, and everything else, and I completely agree. But sadly, we see a lot in the news parents who disagree. A mom who hears Mikey say he wants to be Michelle and is just thrilled, and she's going to get some clout among the other moms because she knows two other women who have trans or non-binary kids, and dads are going, "What's the matter with you?" Of course not. And we actually see courts taking the rights away from the. I think it's almost always the
Yeah.
father that wants the child to stay, his or her actual sex. But there's a problem there. There's a problem in the courts now where courts are saying if that child wants to be the opposite sex, we're going to side with the mother because that's affirming care, and affirming care stops suicides. That's what we're told.
I give many examples in my book of cases in which this happened, families that I personally know. We have a problem. We and parents cannot be overly vigilant. You must be vigilant. Know what your kid is doing on the internet. Know who they're talking to. Know who their friends are. If your kid has a friend that is identifying as something other than their biology, that means that your child has an increased risk of going in the same direction. So I have in the book model conversations that parents can have with their kids on this issue. And you can be a loving and devoted parent and at the same time not accept these ideas and these new identities. It's possible to do both. I'm not saying it's easy, but it's necessary. You are devoted to your child. You're going to do everything you can for them, but the red line is you're not going to deny reality.
Those examples, those models, those conversations are enough of a reason for people to read the book. Parents Lost in Transnation, so you can have something to follow. That is very, very important. Let me close by asking you this, Dr. Grossman. You have said numerous times, and I think you say it in some of your talks, no child is born in the wrong body. But yet, you do recognize gender dysphoria and its existence, or whatever we're calling it, gender identity disorder or whatever. Um, so no child is born in the wrong body, but yet there is that dysphoric trait in some that make them think so. Can you just clarify that to wrap?
Well, that's correct. There are different populations that have this symptom. The little kids, the Jazz Jennings of the world, most of them, a majority of them, if you just allow them to grow up, will get through it. The adolescents that we're seeing now, the what's called rapid onset gender dysphoria, those kids can be helped in many different ways, and also can get through it and accept who they are. I've seen it time and time again. So parents must be aware of it. And even if the child does go through so-called affirmation, it doesn't mean that their core their issues, their psychiatric, emotional issues that are behind the symptom of gender dysphoria have to be addressed. And when you automatically rubber stamp the identity and let them go down this road toward the medical interventions, you're not going to address the core issues. And that's why detransitioners, people who have gone through the medical route, and then they get a little older and they realize, oh my gosh, I haven't been cured at all. I still have my anxiety, my autism, my depression, my trauma that I had before. It's just that now I'm infertile and I have a lot of medical problems. So you
Yeah,
have
and
to address the core issues.
that's so hugely important too. And I was just struck by something you said before about the coding of the conditions a certain way in order to get the insurance companies to pay for the medical interventions. One thing I learned from talking to Chloe Cole, a very well-known detransitioner, is the insurance companies won't pay a nickel for the detransitioning.
Correct.
They will absolutely pay for the
Correct.
mutilations, but if you want to make it right again, they won't cover you at all.
And one of the things, I know we have to finish, but one of the things that Do No Harm Medicine is doing is they wrote a bill that would, for detransitioner care, that would obligate the insurance companies to pay for the detransitioners to be cared for. And that's a bill that hasn't been passed in any state, but it's moving forward.
I'm going to have to look that up and try to push that on every legislator that I talk to because I think that's extraordinarily important. Dr. Miriam Grossman, her book is Lost in Transnation. You'll see it on your screen here, A Child Psychiatrist's Guide Out of the Madness. That is exactly what way, way, way too many people unfortunately need, is that way out of this madness. Dr. Grossman, thank you so much for your time. We really appreciate you.
Thank you so much.
All right. If you found value in today's conversation, and how could you not? We learned an awful lot. Make sure you share this video. Make sure you give us a like, a thumbs up, give us a subscribe so you know when we have great new content dropping here on Strictly Speaking. Thank you for watching. See you next time.